but we're still waiting for them to log in. Let us just kindly give them about 4 minutes, then we start at 10:10. Thank you so much.
Kuna bundle? I think so. Hiyo za 1 GB zinaishanga haraka. Ukiongeza ingine.
Good morning.
Morning.
Good morning.
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 Perfect. I can see now we have quorum. We are already 21 of us online as we wait for the other half to join us. Kindly requesting that if where possible, we can turn on our cameras so that we can put at least the name to the face, and also mute our mics so that we do not interfere with the meeting. So as for now, I can see we have online representatives from various political parties. That is, we have Ford Kenya, we have KNC, we have DP, we have KANU represented, we have LPK, we have NAC Kenya, we have CCM, we have EFP, Forum is also in, and I can see everyone already is here. We also have representatives from the Wiper Party and FAP. We also have representatives from the Ministry of Health. Her name is Rubina Mwenezi. She'll be joining us shortly. She was in and then I think logged out again. We also have a representative from the Registrar of Political Parties, that is Ms. Marjorie. We also have online one of our donor partner, Ms. Phyllis Ombonyo, represented. Without so much further ado, I'm going to kindly request that where possible, where you can just type in, introduce your names on the chat box so that we can go straight to the meeting. And as of now, I'm just going to welcome on board Mr. Rangemwita, our programs officer, to do the opening remarks, and also welcome on board our consultant, Mr. Henry Maina. Range, if you can hear me.
Thank you so much, Maureen, for the good introduction. Ladies and gentlemen, I want to welcome you on board on behalf of the Center for Multi-Party Democracy Secretariat for this important conversation on these protocols. As you know, our governance reform processes are gaining momentum day in, day out, but we understand that the unique context within which this is happening due to the COVID-19 pandemic. Our concern and the reason why we came up with these protocols is because these reform processes can actually be hindered by restrictions that have been put in place, which hinder the freedom of association and the freedom of movement as a way of containing the pandemic. So our thinking was that because each sector has developed protocols on how the meetings can be happening, the church has their own protocols, other meetings, and even the schools. It is important also that for us to steer these reform processes ahead, we need to have protocols that can guide the political meetings as a way of balancing the need to protect the public health and also the need to reduce the democratic space by restricting civic and political rights due to the COVID-19 pandemic. Therefore, CMD Kenya contracted or engaged a consultant who really put in place a very good document. We already had an initial meeting that we discussed this particular document. And today we are meeting again to validate, to see exactly to what extent have our views been taken on board, because we don't want to end these protocols at this point of conversation here. We will be taking them up to the relevant authorities for purposes of adoption and actualization. We are glad, as Maureen has said, to have on board our partners. We have Madam Phyllis Ombonyo. Thank you for so much for joining us from FHI 360. I will be asking her at some point to say hi to us. We also have a representative from the ORPP, who is also going to be very critical in ensuring that we steer this process ahead and ensure that these protocols are actualized. And we also have a representative from the Ministry of Health, being the main body, main organ that is actually handling or working around protecting citizens from the COVID-19 pandemic. So thank you so much, all of you, for joining us. I want to, at this point in time, to welcome Madam Phyllis Ombonyo. Please, Madam, if you are there, you can unmute. If you're able to open the video and say hi to the participants before we welcome our consultant, Henry Maina, to take us through the protocols. Asante sana.
Good morning, everybody. Thank you so much, Range and Maureen, for putting together this meeting and for the invitation. I came knowing that I would take a very back seat, so I really did not prepare much to be able to show my video. But just to say, as you've heard, my name is Phyllis Ombonyo, and I'm from FHI 360. I am the chief of party of a program dubbed Safeguarding Democratic Space in Kenya. And so just from the way the name suggests, we are strong advocates of a democratic society here in Kenya, which we take to mean hearing the voices of the majority in a way that does not exclude the minority. And so we are really pleased that this forum has been put together to try and ensure we have an even playing field for everyone who's trying to advance democracy in Kenya. Thank you so much. I look forward to very fruitful deliberations. Back to you, Range.
Thank you so much, Madam Phyllis, for your remarks. At this point in time, without wasting time, I will welcome our consultant, Mr. Henry Maina, to be able to take us through the protocols. Remember, we had an initial meeting, members, that we discussed. He presented these protocols. We gave our input. Now we want to see whether there is an improvement or not as a part of validating them before taking them up to the relevant authorities for adoption and actualization. Henry, please.
Thank you so much, Range, and good morning to everyone.
Morning, Henry.
I hope people can hear me.
Yes, we can.
Thanks, and glad that I can see a few people who were on our earlier discussion. Their comments were well considered. There would be areas where I must say they made comments, but they were falling outside the remit of these guidelines. So they were considered, but may still perhaps form content that could be considered in other documents. So for those who are joining us for the first time, the document seeks to balance two things. One, a reality that Kenya is still facing a big threat from the COVID-19 pandemic. We have now confirmed that the second wave of the pandemic is here with us. So the idea that we had turned our worst moment seems like it hasn't come yet. Secondly, we've also lost a number of politicians in the COVID pandemic. And this is because either certain laid down protocols were not followed, and or if they were followed, there were some gaps in those processes. And like we know now, doctors, politicians, students, everyone is affected. And it would be critical for us to see what role can politicians play, not only to safeguard themselves and those who work directly with them, but also to safeguard those who attend their meetings and look up to their leadership on other issues, but also on the issue of managing and mitigating the effects of COVID. So as indicated, the guidelines are organized around 10 areas. It's a brief document, and its intention is to complement other existing guidelines. So it does not replace them. It just adds and sheds some light on what we could do as political actors. So a specific thing is that, hello? Millicent, Abuda, is everything well? Hello?
Yes.
Is everything all right, Mil?
Yes, yes.
Yes, so for the time being, the rest of
I'm
us,
fine.
unless you want to make an intervention,
Hello?
kindly just mute.
Yes, yes, everything is fine.
On your end, so that perhaps whatever is happening in your background does not distract the others. So what I'm pointing out that the guidelines seek to complement other guidelines and protocols, but they help us, one, as political actors to design our own mitigation processes for people working in spaces controlled by political parties. So one, do we have clear protocols around our own offices as political parties? Do we have clear mechanisms of managing those who come in and come out of our political spaces during this time? Because we cannot continue to operate like we used to operate before the pandemic. But secondly, it helps us to begin discussing how may we deal with planned and ad hoc meetings that we have as political leaders whenever we are out there. So one, it's perhaps easy to manage the planned meetings, but what do we do with the road shows? You know, those impromptu stops at Mlolongo, at Gikomba Market, that most of our leaders seem desirous to have, even when they know that those could be the hotspots that are going to have numbers of COVID positive people explode. So what do we do with that external environment, which is not directly controlled by the politician, but the politician may have a say in it? So largely that's why the guidelines are important. But the third point is that the guidelines are important because as meetings, public meetings and gatherings were banned, we remained seeing a situation of selective enforcement of the other guidelines. So certain political actors would be allowed to have meetings and others would be stopped from having the meetings. How do we create a level playing field that would enable all of us to observe the protocols, but still meet if we need to exercise our freedom of association and assembly? But I must reiterate that as a constitutional principle, all rights within our constitution, except two, can be lawfully limited. So we must understand that all rights except only two. And those rights that cannot be limited is your right to habeas corpus and your right not to be subjected to servitude. Freedom of expression, freedom of assembly, freedom of association can all be limited by law if it so requires in any democratic state. So those are initial remarks that we must make to that dynamic. So the second part of that is we are asking, why are we discussing this with political actors? It is because political actors play a very big role. When political actors continue to say COVID does not exist, it was a mechanism of allowing a few people in power to make money illicitly. then efforts to mitigate it become more problematic. So yes, it's important that as political actors, we find a way of holding those who are in power to account, but we must not be naysayers. We must not be people who are still questioning science when it is outrightly clear that COVID exists and it's ravaging the world and it's killing people. God has had mercy on us. Our numbers may not look as big, but let's not minimize it, because it can then wipe out the very people we want to protect. So we have a very big role to play in guiding our population, in understanding the minimum measures that have been put into place and how those measures may be facilitated. And I speak this with a lot of a heavy heart, because I asked a number of these questions before Justus Murunga, the Honorable MP of Matungu, died. But those who had followed the meetings of politicians in Western would see that Murunga, even with other underlying conditions, was in many of the public meetings, most of the time without a mask. So now that is a public record. So the question would be, can we be better? Can we adhere to the guidelines so that our followers can also pick a tab on the minimum? There will be a question on are the requirements, having a face mask, having flowing water and soap, too expensive? What can political parties do? But we must begin by showing an example. So the issue of the formal return of political rallies is going to be necessary. And it's necessary for two things. If you are in Kwale County today, there is a by-election that has already been authorized and people need to campaign. How may we change the campaign? And this week, we've had Ghana voting. They've gone through a presidential election. We've not seen the fights of police and politicians in Ghana. And the results have already been announced as late yesterday evening from other countries like Ghana. Why is it that in our own space, we say it's not possible to campaign, but still keep the COVID-19 protocols? So that's a big question that we need to ask. What lessons can we learn from Liberia, Sierra Leone, countries that were ravaged by Ebola? How did the leaders behave in the moments of adversity? How do they behave, those who are in government and those who are not in government? So the issue of return of political rallies is important, especially knowing that now we are likely to have a referendum. How do we canvass our people and the sides we've taken? Now we know that there are going to be by-elections, I think at ward levels in a number of wards. At constituency level, it's automatic. We have in Kwale, we're likely to have in Kakamega, in Matungu, we are likely to have in Bungoma, now that the Kabuchai MP also died. How do we return to formal rallies, but still manage the processes? So the guidelines look at a proposal of having certain policies. And one of the things we are pointing out is that the policies are seeking to just reiterate a number of things that we are aware of, but we ought perhaps to keep looking at. One of them is that we must begin doing social risk assessment. So if I was going to go to a church and the church normally has 200 people, but because of my presence, the church is likely to have 1,000 people, what is my social risk assessment? So that I am better off having the meeting in an open space than in a closed space where we may not be able to hold 1,000 people because the church was meant for 200. Secondly, what are the policy positions we are doing to mitigate once we've understood what the risks are? So we all need to begin having a clear, comprehensive risk assessment for our meetings. But there is need that once we've done that, we begin to also develop a clear risk mitigation plan. So to help us in understanding those things, I have proposed a set of 10 policy kind of guidelines. And the guidelines are: we need to hold rallies in places large enough to avoid overcrowding and contact between the people. So that idea that you have a meeting in a church meant for 200 people, but now because you've come, you have political persuasion, there are 2,000 people flowing on the windows everywhere. Please, let's try and watch over that and see if that helps us to mitigate the situation. The second point is ensuring the safety of people attending the rallies so that no incidents occur that will jeopardize social distance measures. It is an open secret that some of us tend to either give bus fare refunds or some nominal amounts of money for people who attend our meetings. But the order of how such money is paid, in some situations we've seen Nairobi, money being thrown to the gathering so that the fittest of them all picks the money. How can we keep social distancing with such a process where you throw money to the crowd? Yeah, where you want to say hello to people on your rooftop, so people are scrambling to stretch their hands and all come to meet you at the same time. So are there things that we should be saying no to and minimizing? So can political leaders still be having handshakes with people when the protocols have already told us, please avoid handshakes? Why is the big politician still not following that protocol? So ensuring the safety of people attending the rallies so as we don't have those incidents that could jeopardize social distancing. 3, that every political gathering must seek to disseminate safety information to the people days before the political rallies are held at no cost. So apart from you going to campaign for your candidate, please use your meeting as a platform to disseminate critical information on COVID mitigation. 4, kindly ensure that no person is allowed to be at the rallies without having an approved face mask and properly worn. So the idea of having our face masks on our necks, that when somebody else, perhaps a law enforcement officer, appears, that's when we pull it up. We are not just avoiding to be arrested. We are avoiding to spread COVID to other people around us or to be infected by other people who are around us. So that action must be clearly be reiterated. Number 5, that this must be perhaps the minimum we all seek to do. How may we ensure that we provide hand washing and sanitizing spots around the areas where the rallies are going to take place? If you choose that you are going to have a roadside meeting at Mlolongo, then work with the county to ensure that there are hand washing spots and soap enough for the people who will be there. If you haven't done that, then you are perhaps more part of the problem than part of the solution. Number 6, we are proposing that at the start of every rally, we take time to sensitize people around the COVID guidelines, the consequences of non-adherence, and encourage them to respect those guidelines to the best of their ability. For us to be able to do that, we as the political leaders will need to show adherence. So we can't say we will use that platform or invite Ministry of Health officials to help in sharing the guidelines if ourselves are not adhering. I've talked about the issue of number 7, that as political leaders, we have a clear role of not downplaying the severity of the pandemic or rubbishing the importance of science. We can't be science deniers. So if the political party has issues, conceptual differences, we can share them. But we can't be saying COVID does not exist. Because what is our scientific proof that it does not exist? 8, there is need for us to undertake to avoid uttering inflammatory statements during rallies, which may lead to clashes likely to expose the attendees to virus. We've seen this in funerals, including in the recent funeral of Justice Murunga. Politicians use funerals for different reasons. So you have ANC people, you have ODM people, you have Ford Kenya people continuing to think that the funeral of their departed colleague is the best platform to show who is mighty. Sometimes I ask myself, is this right? How can we even teach our children not to dance on the graves of their own departed colleagues when we as leaders use graves of our colleagues as platforms to hit at each other? So this is quite a challenge that we need to take up. And number 9, we are proposing that we engage people on various ways to ensure the safety during rallies, taking the concerns and then communicating the feedback in time. How can we be the platform that can give the Ministry of Health feedback on what is working and what is not working? So let's not just be the people who are saying it's not working. Let's point out what is not working and what could be done better. It's taken a few people to go to court on the issue of the cost that people need to incur when they are in quarantine or isolation, who needs to carry the burden. Now it's very clear that all those people who are retained in government facilities, the government needs to carry the cost. So we need to ensure that people do not avoid going to hospital when they have tested COVID positive for fear of costs, because when they do that, then we spread the disease to many more people. So what changed around these policies is the idea that on explaining the issue of feedback, in the last presentation, I think Imoite and a few other colleagues pointed out that there is need for us to include liaison with nearby hospitals to prepare and receive any patients or cases during that process. They also proposed that we can use rallies for purposes of having mass testing, so that rallies can be used as a process of mobilizing for mass testing. So that has been included. In terms of the health practices that we have proposed, I don't have anything that is new, but just reiterating the issue of the basic practices that have been pointed out. The strongest idea is, how may we perhaps use hand sanitizers where there is no water? So can we distribute hand sanitizers to people in small bottles, but think also about disposing of COVID-19 related material? I've seen situations where when you leave the stadia, you leave the primary school where the funeral was, there are 1,000 masks that have been left on the school compound. There are many sanitizing bottles that have been left there. So how may we consciously also be part of the cleaning up process and a disposal process that meets the minimum health hygiene issues? I've spoken about the issue of social distancing and how meetings must be in perhaps open spaces as opposed to closed areas. Again, the issue of how best we may use our face masks so that we are not donning them as necklaces, but as things that ought to help. But there is a big challenge now on the quality of all face masks being sold in Kenya right. And politicians need to be able to help us so that there is a Bureau of Standard proof of quality, so that we are not pretending we are putting on masks that can't serve as well. There need also to be guidelines. If you are using washable face masks, how many times can you use them before you wash? If you've used it for a week and decided to hang outside in the sun and put it on again, is it all right? Nobody has explained those things in detail to our communities. So I see my mother, who wants to attend political rallies and funerals, just has 2 masks. And when she removes one, she hangs it on some nail in her house and waits that tomorrow she will use the other one. Is it safe? Is she protecting herself, or she's just reinfecting herself for a number of times? These are guidelines that we need to continuously put into place. The issue of how best may we clean and disinfect rally venues, this is something I'm extremely certain I haven't seen any politicians do. And being a person from some of these regions where we have attended funerals, I've asked, why didn't we disinfect the school where the funeral of Honorable Murunga was going to be, prior to the meeting and after the meeting? Because you know standard 4s and standard 8s are in that school the next day. We now left that burden to the headmaster of that school. Is that okay? And I sit back sometimes and say, is this something that would have been too much to ask for all politicians? Disinfectants of less than 10,000 would have done what ought to be done. So where is leadership? So just understanding, I'm going to use Nyayo Stadium. It must be disinfected prior to my meetings. It must be disinfected after my meeting. Those as minimum requirements. If you realize you are not able to do that, then designate perhaps to the local county officials, liaise with them so that they pick that tab, but you pay the expenses. Then you are acting as a responsible leader. The last thing, perhaps the second last thing that I still think is more problematic is that we may, for the first time, be required that we have registration desks for people who attend our meetings for purposes of contact tracing. And this being a pandemic process, we cannot have registration desks that are fixed, people queuing to fight on one line. Please use digitized systems. Give a short code on your premises and say, those who want to attend our meeting, please type in this short code. You will get a response, which means you've given us your details and where you are, we're able to contact trace. So registration is not equivalent to what they used to do to me when I joined the university, that I must queue the line for 8 hours. And we are all congesting ourselves on that queue, not able to keep social distancing. We can still be able to register without necessarily compromising social distancing processes by using digital systems. The issue of temperature monitoring, it can be done, but it would mean that we move to higher surveillance scanning methods so that all of us are passing through scanners, and the scanners can point the temperature as people get into your meeting. So please do not carry handguns, you know, the thermometer handgun, for somebody to take the temperature of 200 people. There is a high likelihood that that person will come out infected themselves. So let's use big scanners, and they can be hired for short term. You don't need to have bought them. But if you are doing your meetings, big scanners can be hired, delivered on the site. Everybody passes through them, and you have somebody recording and looking at the screen. If you have dedicated health officers, they will be able to isolate those who seem to have more challenges, and then you are dealing with lesser cases that could need referrals and the like. So that's largely what is new about those processes. And the issue that I've repeated most of those. But lastly, I want to point out the issue of emergencies. You and me know, for instance, in Nairobi, we've had a situation where somebody died in a car. Fortunately, it turned out that that was not a COVID case. But what if people are going to fall critically ill? There could be people in your audience. There could be you yourself. We've had and seen politicians collapsing in public meetings. What are your emergency mechanisms? Because sometimes there is this fallacy that we are superhuman by being politicians. We don't fall sick. Sometimes you know that you are unwell, but the exigencies of politics require that you appear in a funeral. Because if you don't appear in a funeral, utamalizwa, in quotes, as we say in politics. So in avoiding kumalizwa, you attend a funeral when you know you're quite unwell. And this results in certain emergencies. So have you put into place emergency response mechanisms for yourself and those who would be attending your meetings? If you have done all those, then it is likely that in such emergencies, we have qualified medical personnel. Just like now we know that there will be 2 or 3 police officers in all meetings. Let's begin to see it as a normal when you have an ambulance and nurses also attending the meeting with you. You know, the way you remember to say, nimejulisha OCS, niko na mkutano. Tafadhali, julisha the medical health officer there so that they can also give you 2 nurses and an ambulance. And that would begin to help us to move the process forward. If we all tend to do that, it will be very possible for the president and the Ministry of Health through well-guided processes to allow a semblance of formal public rallies, but with a view that we are better people, we will manage mitigating the risks. So I want to end the initial presentation there and then take any comments or guidance on how best we may move with the process. You would notice that I haven't made an assumption, and it might be a big assumption, that we all have read the document and we have reread it again. So if that assumption was wrong, I stand guided and I'm happy to clarify some of the areas that I may have glossed over based on the assumption that we all have read. Asante sana. Happy to receive any questions and comments. Maureen or Range, back to you.
Thank you so much, Henry, for the elaborate presentation. I can see already we have a hands up from Margaret Ndanyi. Maybe we can just lift our hands there virtually on the chat function. That is where we will be able to see whoever has a question or a clarification to make. So I think, Henry, we can go to the Q&A session and we start with Ms. Margaret Ndanyi.
Okay, yeah, thank you. Henry, thank you for that wonderful presentation. Actually, personally, I have read that document, and I just want to say, reiterate that it's a very good document, very good guidelines indeed. And I want to relate it to the one of IBC, because we equally received a document from IBC that gives us the guideline protocols on how to conduct the elections, and more so with the upcoming by-elections in Wundanyi and Kisumu and other places, but I'm talking about the two because we are participating in them. And as a party, what we have done is we shared this document with our people on the ground so that they can actually start to know how can they start having meetings that are safe. And in very small groups and in open spaces. So I just want to say, Henry, that the issue you've talked about, making sure that the meetings are held in open places, that is the way to go. Than having an enclosed. I don't propagate for having meetings in churches or in town hall meetings, because eventually people still come, as you've said, through the windows, watu wameng'ang'ana hapa na pale, and then the air inside might not be circulating so well. So I want to support the idea of having meetings actually out in the field. But there's a challenge, Henry, in one of the things you have mentioned about the person who has the thermogun taking temperature for about 200 people. It is actually tedious, and actually the person can get COVID. But when you have again more than 1, 2, it's also now an expense. So these are things now political parties, we need to start looking at. How do we go about that? When we have meetings of over 200 people, whom do we engage? Or do we then collaborate with the Ministry of Health and ask them that we are having this meeting, if there's somebody in that area who can come and assist us, hoping that the strike ends, because we know they are having issues. So they might not be willing to come at that particular time. But what I want to say is, through those guidelines, when we got that document, we are validating now, but we have started using it. If you come to offices like our office, the first thing when you get to the gate, there's somebody with a thermogun, and there's water with soap, and then there's a sanitizer all over the office. So I just want to urge my fellow colleagues that it is important we adhere to these things, because COVID is there, and the issue of masks, as political parties, we must sing and sing and sing. Thank you very much, Henry. Those are my comments. Thank you for the good document.
Thank you, Madam Margaret, for those comments. And partnerships can be built. An example, I was in Eldoret last week, and I realized that some of the hotels have graduated from thermogans. They have temperature-taking gadgets that are mounted at the height. Average Kenyans are 5 feet to 6 feet. So they've mounted that you just need to pass your face there, and it reflects on a screen on the other side. That's where the officer records. Ironically, that is an opportunity for innovation. And some people who have innovated some of those may just require us to amplify them. Sometimes they require you to use them in your office so that other people can buy. So let's think through on how best do we move with this, but the expenses are going to be there. We can no longer say we will have this at zero expense. It is the challenge of being a parent. You know, when they say now it's time to buy diapers, those who grew up when they were napkins like me, 8 would be enough. But today you can't say, I'll buy 2 packets of diapers and I'll have done it. You must then exercise that parenthood with the present times. And now this is an expense that must come with it. So I appreciate what you're doing, and we take note that you're already beginning to work. And I must just say that CMD in the processes may have delayed with this validation, but our guidelines were out far earlier than the IBC ones. I even get to know that IBC may have tucked out some of our proposals, and now they are theirs as early. But because we mean well for Kenya, I don't think we are going to fight on copyright. Thank you. Maureen, who are the other people? I can't see the hands up, so you will need to continuously pick them.
Henry, so far I cannot see any hands up.
I've just seen Jesse Saruni indicating that the discussions are timely, looking ahead to great engagements. Thank you. Rosalind Luvaha, it touches on our lives. It's bigger than just our political parties, and we need to be able to understand that. I appreciate Luvaha. So most of us, I know that for those who were in the meeting before, like John Imoite, I remember that time mispronouncing his name with Amoit, and I said that I have a cousin called Amoit. But now I've gotten it right because I called her to try and say what is the difference between Amoit and Imoite. So John, do you want to say something? You were in the previous meetings. Do you think we are making headway or we're still stuck?
Thank you very much, Henry. Maina, thank you for the presentation you have made now and even the earlier one. Of course, we are making progress. We're moving ahead. I could say also that from observation, there's perhaps a little bit of a difference between when we had our first session on this and now with the behavior of the political class in this country. Somehow, save for the few situations where we've had federal groupings, I think if you looked at the campaigns, perhaps they're a bit moderate in how they go about it. There's observable observance of the guidelines that have been put in place, which is commendable. It's a commendable thing. But from my part, I would still want to urge stricter compliance, more observance of some of these guidelines, because we interact with our fellow Kenyans out here, and we hear them. We hear them, especially on this thing about the confidence regarding the message that comes from the authorities. Like you pointed out, Henry, I don't know whether you can call them science deniers or just people who just want to keep saying this COVID is manufactured by this government because they have some intention, you know. So we have still a good section of our population that disbelieves that COVID exists. I don't know how at this stage in the COVID situation, somebody can still be in that space because it exists and it is ravaging populations, and ours is no exception. So therefore, you have these people out here, and the way COVID behaves, you can't say that you have secured yourself and you have a neighbor that doesn't observe these things and you still regard yourself as safe. Because if your neighbor, if these people you interact with are not observing the same guidelines, are not observing the same rules, then you're at risk, as it were. So it will be important. It will be important then for the authorities, for government, especially the Ministry of Health, to still, reinforce the message that COVID is still around. and its impact could even be severe as we go along. And that it's important to observe the guidelines that have been put out there. If you looked at just this morning, I was just a little bit on the news. I think somewhere Denmark is being cited as the best case in terms of handling COVID. And you listen to the interviews that were done with the people in Denmark. The key things that came out were they have a lot of trust in the message that comes from the authorities. And therefore, when they say mask up, everybody goes that direction. There are very few other people who would not do that. Wash your hands. Don't go into places where you have big gatherings and things like that. They're even saying that for Christmas, don't have more than 10 people. If you have to have a celebration of whatever kind, don't have more than 10 people. And you hear the Danish say that, yes, that's basically what they're going to do. So for us here, I think even as we are saying the kinds of things we are saying with the guidelines that we have out, yes, there is some progress. But I feel there's still need for us to push it. Because even as we speak, I think our villages are beginning to feel the impact of COVID. Where I come from in Busia County, my village, in fact, there are cases there. Kolanya High School was in the news the other day with that outbreak. There are people who are my relatives who have contracted COVID and who have survived it. So this thing is out there. So if only we could emphasize this message, it goes to the people, and we do these very, I call them common sense things. Just wear a mask, wash up, avoid big gatherings. And for us politicians, I don't know whether it could be done because, Henry, you cite the Ghanaian case. The Ghanaians have just done a presidential election, and the campaigns were largely on social media. You didn't have very many people gathering around and what and so forth. So I don't know whether we could think of that. Of course, there could be challenges in terms of how we could do it, network and what and so forth. But perhaps then you could say, what is the best way of doing my meeting without having to endanger the lives of the people? Otherwise, for me, we're making progress, but there's still more that we could do. Thank you.
Thanks, John, for the kind remarks. Glad. Of course, there's been some change, but the example, Ghana is a country that, in terms of digital networks, Kenya has far better spread of digital footprint. Kenya has more people that are literate than Ghana, but there needs to be a reverse. Kenyans are on social media for attacking other people. So how do we also nurture a behavior where social media is the place we can meet for these other progressive reasons? An example is we are holding a third or fourth meeting with CMD, and Henry has never left his living room to go and meet the 40, 50 people that I've met. But now you know me, you've heard my voice, so it's still possible. So perhaps it's us also who need to make our members and our followers understand that we can still speak to them on Facebook Live. I remember President Erdogan of Turkey safeguarded himself from an attempted coup by using social media when he is the person who used to cut it so that others don't use. So it's possible that we can put it to different use, and appreciate your points, but we also need to be the people who need to give a message of hope. I don't know perhaps how to capture that in the guidelines, that it's only 1% of people who've tested positive of COVID that have died. So if you manage it well, yes, we will lessen the number of people who contract it. But if we manage it even far better, those who contract it, largely 90% would get better. Of course, with varied effects that come depending on how it devastated your system. So also beginning to give a message of hope is something that we can work for, so that those who test positive are not stigmatized to death, because sometimes you are being just left to die because you are positive. Nobody is attending to you. So how do we bring that message of hope? It's something that perhaps ought to be discussed, even though it will not be captured in the guidelines. But we must be the messengers of hope and say the world is not ending. Some of the apocalyptic thinkers are beginning to say that this is the end of times. So thank you. Tabu Daniels, I felt you had your hand up at one point.
Hello. Are you able to hear me? Hello, Henry, are you able to hear me?
Yes, Tabu, we can hear you.
We can hear you. Continue.
Hello? Hello?
We can
Hello,
hear you.
Benjamin.
Yes.
Is that Benjamin?
I can hear you.
Speak up then, we can hear you.
No,
Closer to your mic.
I was responding to Tabu that we can hear him. Let him continue.
Okay, Monsieur Tabu, we can hear you and we can also see you. Tabu Daniel, tumekupoteza. Perhaps as we try to get him, somebody else who may have a comment.
Henry, I can see Nicholas Melly's hand up. Maybe he can continue speaking.
Yes, just pick them then, because I can't see the hands up. Okay. So Maureen, kindly pick up those who need to speak.
Yes,
Thank
Nicholas.
you, Maureen.
Yeah, okay, welcome.
Thank you. Mine is a concern. I think the Ministry of Health is doing little when you go down to Machinani, because these rallies, these by-elections are happening in those villages. Villages where people are reluctant to follow these guidelines. All of us have traveled to one point to our country, and you've seen people don't wear masks, they don't have sanitizers. Somebody goes to the shop, it doesn't sanitize, he buys, he gets money, exchanges, you know. I wish the ministry could dedicate some few resources. As they know, like there's a funeral in Machungo, for example, last time, they have some few staff strategically positioned in entry points and just encouraging people to put on their masks well and to wash their hands. But you see people are just flocking into those venues without anybody sensitizing them before they get into the venues. Likewise, these rallies by, these politicians where we have by-elections. These areas, when you know there's a rally in this locality, why don't the Ministry of Health, because they have their facilities, the hospitals are there, the dispensaries are there, why don't they send 2-3 people to just be close to these places where meetings or rallies are happening, to just sensitize people? Kindly, when you're attending that meeting, put on your mask. It's a risky thing. You know, you can contract. You don't know if people have interacted with who. You know, side things. So I think Ministry of Health is as much as political parties were trying to sensitize our people, we're trying to put those measures in place. The Ministry of Health needs to at least pull up their socks and do something more. Thank you.
Thanks, Melly, for the comments. That's why we are seeking to establish some partnership. Sometimes Ministry of Health people alone may not be able to make people participating, your supporters in a political rally, follow certain instructions. But if you are the one saying it, then it can become possible. You would say, before you come in, we need everybody to have masks. We need to have washed at 3 different points before you come into the venue where we are having a meeting. Then Ministry of Health people may be there if you've conducted them in advance to help in some of the others. So there is an issue here about ownership. The space of politicians is their space. So you must show leadership at that point and seek support from the Ministry of Health. Where we perhaps have sought that and it hasn't come through, then that would be a political discussion. Why isn't the Ministry of Health using that opportunity to support politicians who are helping mitigate the spread of COVID? But I hear you, and thanks for your comments, Meli. Maureen, any other person that's want to make a comment?
Yes, I can see Tabu is back. Tabu, kindly continue.
Hello, thank you, Maureen. Am I being heard now?
Yes, Tabu, we can hear you.
Hello.
Yes, we can hear you, Tabu.
Let me join the rest of colleagues in appreciating Bwana Henry Maina for this presentation. I also want to say, I'll join the rest to appreciate the background info that you are able to provide to us. This is what I wish to share. One, in as much as one would say it's not part of the protocols, with COVID around and knowing the behavior of Kenyans, you know, it's unfortunate that we are in the political class and every blame will always be on us. Even if our members steal, they expect us to tell them not to steal. Yet we know that you have no capacity whatsoever to stop a thief from stealing. You will tell me not to steal, but if that is my nature, then I'll still go ahead and steal. But I'll be blamed because I'm in the political class. To avoid such, I was going to propose that is indeed possible for us to talk about a policy in place by the Ministry of Health that is going to ensure that they have what we call the reducible minimums with regard to these back to rallies approach, in which case, as it is a law that for a rally to be held, notice has to be given to the police. That notice is not by volition. It is actually a legal requirement that if you don't do it, then you will not proceed to have your rally. So equally, I will go the view that we need to go just beyond these public relation or friendly arrangements between Kenya as a party and the Ministry of the people at Port Victoria Hospital, where TAB is going to have a rally at Port Victoria Primary School. I believe that would be of help to us. Two, moving forward, is indeed possible for us to begin to think of amending the law.
Tabu, can you unmute? You're muted by mistake, I think.
No, I'm on. Are you hearing me, Maureen?
Yes, continue. Yes, kindly continue.
I was proposing that is indeed possible that it is high time we started thinking of online registration of voters and moving further, amending the law to allow for online voting to avoid these crowds. I can bet, and this you can take to the bank, in 2022, hiyo story yako ya social distancing, tukipiga kura, no politician will tell people not to keep it. but we don't have enforcement officers who will ensure that is done. So instead of us waiting until we die on those queues, I believe that we can start that conversation mapema. And number 3, the Ministry of Health needs to up its game in terms of the Kenya Bureau of Standards stamp. We are having masks on the market. Unanunua mask, ukiivaa imekatika. Surely you have asked about the quality. Now, as a politician, yes, somebody will say you are the people who legislate. Others are cutting corners. What do I do as a politician when the law states this and practice is different? So the issue of sterilization of the masks, I believe, and we have seen all sorts of masks on the market. Nobody is saying anything. Why is the ministry? Are they waiting for politicians to, or do they want Matiang'i to go and mop up? Lastly, this is a request to you, Henry. I am excited with this proposal of scanners that could be used for large crowds. But I don't want to be naive. I want to admit that I don't know where I can find them. So if you have any contact that you know where these scanners could be accessed, whether on loan or to purchase, just kindly share that contact so that then it makes life easier for us and do what we really must do to save this nation. Thank you very much.
Thanks, Tabu, for those comments. On the last one, perhaps I would look at if I can get access to contacts of the suppliers and then come back to you. But once a parent, always a parent. You might have a rogue son. He doesn't stop being your son because he's old. So as a leader, one of the things that comes is that you take blame. But when there is praise, individuals take it. That comes with the territory. So how we induct ourselves towards this process is a good thing. In terms of standards, I think there is need for us to make sufficient noise. And the role of politicians is not just to make laws, but sometimes even to petition to do this. As a civil society member, I've been petitioning, but I ask that rarely do I see political parties in court to say this is wrong. Yet it's still a means that can be used if all others have failed. So let's encourage our members sitting in county assemblies or sitting in National Assembly or Senate to raise those questions on our behalf so that we are protecting our people. Remember, your followers are buying masks with the belief that those on the market have been approved and serve the purpose. But if you notice that some are not serving the purpose, please amplify their voice because that's what you exist for. The ministry ought to be reminded every other time, and that's our accountability role, that they must be able. On the issue of enforcement, we've said if we worked together with Ministry of Health and the Ministry of Interior, we will be able to enforce those things. But we always know that if that enforcement happens, then Tabu has less crowd, and crowds are our currency. So that's why we run away from enforcement. It's not like it's impossible. When we want to have very few people in our home and we have 2 APs standing at the gate, it happens. But when we want crowd so that our opponent can realize that we are big force, we tell the APs to sit at the back of our house and let people come in. So I make those comments as a political observer who sees how politicians behave. But it is in this discussion, I say using Camden rules, I'm trying to just urge you to come back to being humane enough. And sometimes on the issue of COVID, we can't play politics with it because we won't have the voters. But I take two things from your proposals. How may we begin to have a discussion on online voter registration and online voting as big discussions? So I hope Range, Maureen, and all the others hear this. It's not part of the guidelines, but it ought to be that if we all registered for Huduma numbers, then can we just have that as a voters register? And we move on so that we are not going to have these crowds. And then with a short code, somebody can only vote once. And we can all get to know the results in a shortest time. So it will have many advantages. In the year 2012, I wrote about this, but I was told that I was working with those who want to ensure IBC does not have money. So because voter registration is the cash cow of the process. But good proposals, very strong proposals that can be taken forward. And in separate spaces, I'll amplify them and give credit to Daniel Tabu as my elder brother. I know I had an elder brother called Tabu, so I'll always make that reference. Thank you. Next, Maureen.
Henry, also have comments on the chat section from Roslyn Luvaha.
The Roslyn one I had read.
There's another one.
Chepkemoi.
One saying, yes, Roslyn and Chepkemoi, but Roslyn is saying we have a big challenge in our country, even the gadgets, in brackets, the thermogans. I think they were manufactured for business purposes. I interrogated a personnel at a busy supermarket, and the guy said for the past 4 months, when they have never measured a person with more than 38.6, temperature rise. So that might be one of the,
Okay.
the comments there, and that is actually a nightmare. So it means that even it actually goes back to Tabu's question on the masks on the market and and cabs. What is it doing? If these thermogans cannot be relied on, it means we even having persons who have been infected going into the supermarket, so that's even the security guards at the supermarkets noticing. So that means again we're not curbing this spread of the COVID. So again, that is a problem, I think, in the quality of the gadgets and the masks that are being allowed to the market. And then Amy says, the guidelines are working well in the urban areas. The worry is shifting to the rural areas. People are so reluctant and life is as normal as before the coronavirus. There is need to enforce these rules and enlighten them more. So again, I think we need to do civic education to watu wetu wa mashinani so that they can take this virus seriously, because it seems that watu wetu wa mashinani, they're not adhering to the rules, because clearly from Amy's comment you can see watu wa mashinani, well, it's business as usual, and we know it's business unusual as of now. So we also need that civic education there. And then Abubakar is saying, just thinking aloud, like scenario in Msambweni, can an aspirant sanitize a political rally ground prior to the gathering? Do the aspirants have goodwill to pay for it, or will they be cutting costs? So that is his question.
Yeah, thanks, Maureen, for going through those comments. I think the question that Roslyn is asking is a question of standards. And if we have any colleague from the Ministry of Health, I think this is something they need to step up to. Do we have non-standards? It's only in Kenya sometimes that when you have this crisis, we tend to buy substandard gadgets. Remember the screening machines that people used, they are detectors, they are metal detectors as it were. And we were sold a number of them that were fake as a country during the height of terrorism attacks. Now we may have bought thermogans that are not doing anything, because while other countries have clear standards, Kenya receives anything at a time of a crisis. So I would really like to hear colleagues from the Ministry of Health, or anybody who's laid their hand on any document that says what is the standard for thermogans, what is the standard for body scanners. Do we have them, or we leave those to our manufacturers to come and tell us their own specifications, and then we make their specifications our standard? So there is a big gap there for any would-be policymaker. And I also think that if within your political party you have policy advisors, this is where you can take leadership. You can begin to show leadership by saying, this should be the best policy framework for standards on this thing. Those in power, if your party is not the one in power, might frown about it, but the idea will become popular over time. Where you perhaps have difficulties, that's what Henry does like. So he will come in and charge you some money and develop the policy anyway. So, but we need to be able as a country, the other day I asked, do we have any standards about phones? When do we say a phone is substandard in Kenya? And who will say that? And I noticed that it's very hard. Phones that have been rejected in Europe are sold in Africa as new ones because we don't have standards. We just have standards. Does it work? If it works for today, then it is okay. So that's what we need to think through. Abubakar, I hear you, but who is this person who wants to lose the election? Because most of your supporters were quite sick the day of election. So paying for this cost is a selfish way of ensuring that a politician wins with people, because you can do your campaigns without caring, and most of your would-be supporters would be unwell on the day of voting. What would happen? You lose elections. So it may be in your own interest that they are healthy and surviving so that you get the vote. So the goodwill is self-preservation also for the politician. So there is what I'll call an incentive for a politician to do this. But also I know that there have been many people who are willing to support in provision of sanitizers, provision of water tanks, and the like. And as politicians, let's just use that as an opportunity to mobilize so that we get those things on the ground. The hard principle about how our rural populations are behaving. I've been to my village and they say, "Watu wa Nairobi ndio wako na corona." So when I remain with my mask, they say, "When you are Nairobi, sasa umetuletea corona," because for them, there isn't. So we just need more civic education. And I think that the president at one point was saying that there's some money that was set aside for artists. We need some money dedicated to the media, especially the local language radio stations, where we all continue to tell people that coronavirus is here and it can continue to ravage us if we don't keep to the guidelines. Any other comment?
No, there's no any other comment on the chat section.
Can I just chip in something? Hello?
Yes, sure, John.
This Henry and colleagues may not relate directly to what we are discussing, but I think in some way it does. I don't know how we can go about this, but even in some of the things that you have said, Henry, and of course which have been said by colleagues here, we've kept mentioning doctors, nurses. Let's hold a meeting, and so as we give notice to the police that we don't have a meeting, can we also give notice to the nurse, to the doctor, so that we can have one around us? the thing is this. We all know our doctors and nurses are going through the most difficult of times. They are facing challenges. They don't have enough PPEs. The numbers of doctors and nurses, specialists that are going down because of COVID is alarming. And when you listen to proceedings, I think these were proceedings in the Senate, where there was an investigation about what transpired with KEMSA as such. You hear of PPEs that are in some stores somewhere, which the medical personnel either cannot access or are just not being given. My question, a wild one for that matter, would be, who's speaking for our doctors? Because for us to succeed in our efforts to contain COVID, I think there's just no way we can ignore the role that doctors and nurses are playing in this. Even the COVID deniers themselves that we have known worldwide, including in our own country, once somebody falls sick, they end up in the hands of a nurse, in the hands of a doctor. But we don't seem, as a country, to be paying enough attention to the plight of this critical force. So I'm just asking a wild one. Is there a way in which the political class, I don't know, Henry mentioned earlier, there could be people here connected with the ruling party. Is it possible for people to talk to people at high levels of government, bring this to their attention that there is a problem out here? We can't be losing specialists. We can't be losing doctors and nurses at the rate at which we are, because we have not given them, PPEs and the rest of the things they need. I don't know. It's just a wild one for me. I don't know. Thank you.
Thanks, John, for that comment. It's stressing, to say the least. I know a number of those doctors that have died. Some are my colleagues in school and friends, and sometimes it's just annoying that those who have sacrificed to be in hospital at this moment to heal others are the ones that are left to suffer by themselves. So I think we all need to find it within ourselves that we do things different. Doctors are not dying because we don't have money to buy PPEs. Doctors are dying because we are refusing to make decisions in good time. The young doctor who died a few days ago was in a private facility for a week. And if we had just made the right decision when he was writing even on social media, we would have been able to save his life. Similarly, those who have died because they didn't have enough equipment, yet by October, we had sufficient supplies, at least of PPE. It is the other reagents that are needed for testing that were running out. But we seem, for whatever, it's a centralization kind of problem in the country. Sometimes there are people who just want to look good when they are holding on everything. So you look big, you are the one people have to write letters begging you for things. Why wouldn't KEMSA even give counties these PPEs at a debt?
Yeah.
If we are holding them and counties can't pay now, passing to them as a debt. Because they are needed now. They will not be needed when counties can be able to pay and everybody has died. So it's a policy decision, it's a quick reaction, as a person, I find it difficult, but I've shared where I can the platforms that just distribute those PPs. Understand, have a quantifiable way to know that Kakamega owes 200 million, let them sign for them, and let them keep them. Give Matakos what they need. Don't have KEMSA keeping them so that we look good, that as a country we have a store. It doesn't help anyone. But that sometimes people have reminded me that's why you never worked in government, because you don't know how government works. So those who have worked in government can find a way around us and begin to tell us that governments can also function. I was reviewing Rwanda when Kagame released Rwanda Air to go to China to bring certain equipment, and he used the presidential jet to distribute them around districts in the first week, and that's done. So if you ask somebody in the biomedical center in Rwanda, they are not the store keeping those gadgets.
Yeah.
Each district is keeping theirs. And Kagame must receive a briefing every morning. The way the commissioner of prisons receives a call from all the officer in charge of all prisons in the morning to say lockdowns and those who are living, Kagame must receive such a call. We have a cabinet secretary that was fired the second day after they declared COVID. Why? She said they had enough stocks, yet they didn't. So when now he went to the second time of the question, how much of each do we have? When she had said we have enough stock and she couldn't respond, and she was fired there and then. So can we change that? Of course, in Kenya, they would say, oh, you don't fire people like that. But can we bring this thing back to public service? So I hear you, John. It is a question that we all continue to ask in different spaces. I have asked a few people that are close to the CS so that he just understands this and can make the right orders. When he says, I have made an order and he doesn't write, it is criminal negligence. And as a human rights person, I know that if that doesn't work very well, soon we will drag him to court. That would be our way, and it's a last measure, not to threaten him, but to just make him realize that criminal negligence is still an offense, and we will drag him to court if Kenyans continue to die for things that we could have avoided. So I hear you, but that is not for the guidelines, it's just for our ranting as affected Kenyans.
That's all right.
Maureen, is there any other comment? Maureen?
Yes, Henry.
No,
I can hear you. We
yes.
have one comment from Rosa Wangu.
Do we have anybody from the Ministry of Health?
Unfortunately, I think she just logged in and logged out. She's not online so far.
Yes.
Cannot see her anymore online. I think she just logged in and logged out. I don't know why, but we will contact them. Because Rosa Wangu actually is asking, can we consider having medical personnel and security officials present in the meetings? Yes, Rosa, maybe I can just answer you that. That is a yes. We had invited representatives from the Ministry of Health and from the Ministry of Interior and Coordination of the National Government. Fortunately enough, someone from the Ministry.
Maureen, not in this meeting.
Yes.
In our gatherings on the ground. I meant in our meetings on the ground, not this meeting.
Yes, I think the document provides for that, but again, it has to be organized by the party. We have a part in the protocol saying that we can consider having,
Yes.
medical personnel, actually a nearby hospital being alerted, and also having ambulances on the ground, and also having security officials, like to control the gatherings and the, the lining in and out and the overall, conduct of the political party. I think, yes, that is possible. And I think Henry has also included that in the protocols. Henry?
Yeah, for sure we can, and that's the proposal we are making, that the default line for political meetings is to have an AP. But now we are saying for emergency purposes, the default line is to have an AP, to have a nurse or a clinical officer, and to have ambulances around. If we begin to do that as routine, even post-COVID, that would be a good measure so that we as a political class are not just catering for ourselves. That if there is an emergency, we, the political class, would be evacuated by our big cars. But if there is an emergency for our supporters, they tend to be left on their own mechanisms. So it's a positive proposal. It's a good practice everywhere that we begin to think through. Of course, it comes at a cost. The way you speak to the OCS and you pay for some money for the AP or the 2 police officers that come to your meeting is the same thing that would be expected when you speak to the medical officer who will release either clinicians or nurses to be on standby, and also ensure that there is a dedicated ambulance within the vicinity that can be relied upon in case of emergencies. So it has a cost implication, but how best we begin to think through it is when we do what I called a risk assessment and a risk mitigation plan as a party and set aside resources for such processes. Then it becomes easy for us to effect it. The officials from the Ministry of Health are not in, but I hope that we have shared the document with them. We will continue to seek to engage with them in good faith because we all mean well. We just want the country to be safe for all of us. So we will continue to try and open different mechanisms on how we can engage and speak with each other, as opposed to now when we are speaking at each other because they are not here. And that would be my way. If there are no any other comment, then Maureen, perhaps you guide us on what would be the next steps with this team, where they can see the document in the final version, because it ought to be taken by the ministry for the next level processing, or CMD perhaps would call the party leadership of its members and endorse the document publicly, and then put pressure on the ministry to accept it as their way of doing things.
Thank you, Henry. Before we just go to that, I can see Abubakar's hand is up. Abubakar, if you can hear me.
Madam, how are you?
Fine, thank you, Abubakar.
My issue is about contact tracing. I'm zooming in Sambweni. Is it really possible, contact tracing, when we have such rallies? I don't believe this will work. Although in such places, Ministry of Health usually send their officers to talk about, to tell us to have water, running water, sanitizers, and whatever. But contact tracing, is it really there? When we go for rallies, people will be telling, hey, today there's a rally so and so. Can we go? Yeah, and a chota. So people will go. They'll just be picking themselves. I don't think we need it, but our kind of rallies, political rallies, like the by-election in Sambweni, it won't add up. Thank you.
Yeah, Abubakar, I hear you. As a country, if we don't want to do contact tracing, then we just don't want. It's not like it's impossible. I'll give you an example. When you register 1,000 pupils in school, one secondary school, Maranda, in Nyanza, has 5,000 students. When one student falls sick, are they not able to trace the parent? They are, because the school administration has understood that it is a minimum process to process that information in a way that they can be able to use it. School teachers do it. Yeah. Security officers do it when they want to trace you in this country because you committed a crime in Nairobi and ran to Lunga. They trace you. This is the same country. But when we don't want, we say contact tracing is hard.
That's a nice one. That's a
It
nice
is
one.
impossible. All we are trying to indicate is let's change our ways. It begins to be important. If Abu Bakar is the host of that meeting, take a short code, buy a short code, let people send you SMSs, I'll be attending your meeting. Send them a message with a short code. You come back, we check through phone, are you among those who had registered? For us to attend this meeting today, Maureen sent us a registration. She's able to trace who was in the meeting. You see that? So contact tracing is not this inhuman, impossible thing. Maureen is able to know that Abu Bakar was in this call and Abu Bakar left after an hour or 35 minutes. If you log out, it's possible, and that is for contact tracing. So then the physical process of saying, if then we were 31 when we started, Henry Maina has tested positive, and therefore there are likely 10 people who are in this meeting ought to equally be tested. Not all of them will turn positive, but some who will turn positive would need to be managed. It must be a conscious process. That's all we are asking. It must be a conscious process. We should not leave it to chance. We should not leave it to nature to naturally contact us. Because when we leave it to nature, we only know that you are in that meeting when you die. So nature has a way of contact tracing. You will die without medication. Then we will know you are in that meeting when they do the test posthumously and it says you are positive. We are avoiding nature to do the contact tracing for us, that we must put up processes that help us. It comes sometimes with an extra cost. It requires some extra thinking, but it's not impossible. I've done meetings where I've helped a few of the political parties to just think through this process. And I'm able to share on how that is managed. So you do small meetings of 100 people. Every cell has the mobilizers, and the mobilizers of that cell are expected to know who came to the meeting. And I remember how Madam Margaret Ndanyi started. He said they are not doing big meetings, but they are doing them in open spaces where they are doing small meetings. They know who attended. They are able to do certain things with them. So if you have mobilizers for every 100 people, what would make it impossible for Abu Bakar to know who attended the meeting? Even if your party is watu wengi, wengi, wengi sana, as the motto of one party used to go, you will still be able to trace them. But that is in jest, it's in, in jest. Thank you, Abu Bakar.
Thank you, Henry, for that. I can see Maggie's hand is up again. Maggie,
Yes.
if you can hear me.
Take her, please.
Yes, I can hear you. Thank you. I just want to comment on what my brother Abu Bakar has said, the issue of contact tracing. I think if we have to actually fight this virus, then we must be very, very serious about contact tracing. Even in our own homes, we need to do that. You know, we start in a small way. If people come to your house, you need to know who has come to your house. And in case one of them falls sick or you fall sick, then you really want to trace and see, on Saturday, I had this number of people and we are sick, and you trace. You'll also be helping those people to help the country. Now, back to the political party. As I said before, like in Wundanyi, do a targeted campaign. Target whom you want to meet. Don't just meet thousands and thousands of people who today they are meeting candidate A, tomorrow the same people are meeting candidate B, they are meeting candidate C, the same lot. Do a targeted campaign. To every village you are going, you know you want to talk to 50 people. You are going to do registration of these 50 people because you want to have a one-on-one. You want to take their details because later on, I want to talk to Abubakar and convince him that, please, Abubakar, vote for me. I don't have to meet you in person. Once I've met you once, then the next time I want to talk to you one-on-one. So let's have a targeted campaign where we can trace. We need to think out of the box and don't do things as usual. Now things are different, so we must just come up with new ideas. Thank you.
Thank you, Mom, for those remarks. It's possible if we look at it differently. How many of us will have 100 people appearing in our wedding, give us presents, but we don't know who to thank? We've been doing contact tracing as a country for a long time. There is a system you put at your registration table of presents, and you say a small book or have these pin-up things on paper, write the name and contact of the person and pin it on the present. Afterwards, if you are a good couple, you will write to them to thank them, however many they were. So we've been doing contact tracing in different ways. It's just that when we think it's being done by the police and others, it becomes impossible. There are times when girls used to disappear and get married without anybody knowing. Using traditional systems, you will still do contact tracing and know where they have gone. So contact tracing as an aspect of our life has existed for a long time. It's just how do we refine the positives of each different way of contact tracing, and knowing I met so-and-so, he's unwell. Could I have come into close proximity with them so that I also need to be tested? So remember, we were also using the opportunity to do mass testing, that if we can keep mass testing in our meetings, then over time, when the results come out and I had 200 people and 3 of them are positive, contact tracing does not become too hard, because not all the 200 will turn positive, that we need to trace their contacts at the same time. So that's the import and the philosophy. Of course, extra resources would be required. And in our last discussions, that's why we wanted perhaps Ministry of Health colleagues, so that we can see, are there resources that can be allocated to political parties for this purpose from the COVID funds? If not, how may we as political parties mobilize for this role, or try and advocate within the National Assembly for such allocation to come to our way? You know, how may we ask IEBC to allocate some resources to the approved candidates for that purpose, now that it is clear that campaigns will go on? So these would be the questions, these would be the principle and the guidelines that can inform that engagement we may want to have with the ministry, we may want to have with IBC, in how to ensure an effective process, but that is also safe for candidates and their supporters. So we say thank you. Maureen? Mimi
Yes.
sina la ziada. Wewe tu tuongoze.
Okay, Henry, thank you so much for that elaborate presentation, and also, you know, getting the Q&A and answering questions from our participants. And let me say that this forum has been very fruitful from my side. I can say that because, you know, in addition to the views we had on the meeting that we held on 20th of November, now we have at least more views that may go into the protocol document, the final document, or that may be, you know, worked on their own in a different forum, and not necessarily going into the document. Like, for instance, you know, having discussions around voting online and having KEBS to come in, you know, to say these are the standards that we have. so that they can ensure that at least we have, standard equipments out there, like the thermoguns, and also standard masks that Kenyans use to protect them from this virus. So from us here in CMD, let me just say asante sana to everyone for attending the meeting today. And your views are very invaluable, and we will also, include them in our document. Let me say that our way forward now, this actually marks the last meeting for this validation of these protocols. And our next engagement will be with a Registrar of Political Parties, the Ministry of Health, and the Ministry of Interior and Coordination of National Government, so that we can at least have their views into the protocol, especially from the Ministry of Health. I think we'll just follow up with them after this meeting so that you can see if you can have them in for the afternoon meeting. And if it's not possible, then we may want to, reach out to them individually so that we can ensure that they are aware that we have this document, and so that they can actually give their input. Our final destination for this document, I think, will be with the Register of Political Parties. As CMD Kenya, we're planning to hand it out to them so that they can be the ones enforcing this document, and also, adapting and enforcing it, so that we can actually have our rallies guided, so that we can actually curb this COVID-19, as long as we know that we are going to protect our, our electorates, and then we'll be good, on the ground. We don't want to go out there campaigning and doing everything, knowing clearly that we're endangering their lives. And then at the end of the day, they will get sick. They will not show up, as Henry would said. They'll not show up for the final voting, and eventually you might actually end up losing. So we want to avoid that. And as much as we still want to, continue fighting for our democratic spaces as political parties, we also need to protect the lives of the Kenyans. And so that is why we're here with this document, and I think now we're good with it. And then I will just hand it over to the ORPP, as I'd said, so for adoption and implementation. So without so much further ado, I don't know if Range can hear me so that he can give his final closing remarks. And apologies from our Executive Director, Mr. Franklin Mkwanja. I know he was in and then locked out because he had another meeting that he's also actually attending virtually. For those few remarks, asante sana from my side, and have a lovely day. So let me just welcome Range. Range, if you can hear me.
Thank you, Maureen. I think you have spoken very well about the way forward with this document and what we expected to do with it. Next week on Tuesday, we are going to release the document to the public through the board meeting that we have with the senior leadership of CMD Kenya member parties, and also the other actors that Maureen has mentioned. I will not belabor to repeat what she has said. I think that is the position. Only thing is that we need to see how we can actualize this. I understand that Henry talked about nature having a way of contact tracing. We don't want to be traced naturally. We could actually, the small ways, the small proposals that are in these protocols are the ones that can help us to be traced through the scientific means. Because I can see our seniors here in this meeting from the board, I will request one of the board members to officially close the meeting, Mr. Tabu. Thank you so much.
And thank you very much, Range, for this opportunity to close the meeting. But before I do that, I want to profusely express our gratitude as political parties to Madam Phyllis Ombonyo of FHI 360 under the SETS program, Madam we hear you and thank you for reminding us that you are a democratic, you are an organization that advocates for a democratic Kenya where the voice of the majority is heard without excluding the voice of the minority. That is our provisional, our constitutional provision in terms of inclusivity. So I want to say thank you very much on behalf of political parties, and to say may the spirit continue at SEDS. Express the same to the rest of your colleagues at FHI 316. Two, I wish to appreciate the participation of my colleagues in this particular meeting, and especially the input that we have had, being the second of its kind. I also want to say a big thank you to Henry Maina for spending your time and energy and intellect to put these bits and pieces together for us to have a document that we can always refer to. I want to believe that as parties, we are going to avoid being traced by nature, because if we are traced by nature, then we become extinct. Yet we are existing to ensure that we play our role in terms of enhancing democracy. I want to request, in as much as we have had the way forward from Maureen and then Branch, that Madam Phyllis, from where you sit, please don't say that it is over. It is never over until it is over. Can this conversation continue? Can you, if you didn't provide for any funds in terms of printing this document, launching it, so that it becomes part of our archives, that we can always feel like this is a product, we worked around it, and then we were able to give it at the best shot. Please, if you had provided, thank you very much. If you had not provided, kindly look at the remnants that you could be having. But it's a good document. It's a document that is going to help us to move forward. To my colleagues in the political parties, times are tough, but the tough must get going. And I know we have the capacity to move. Let us not do things the way we used to do. The CS of health told us that this thing, if we treat it normally, it will treat us abnormal. Now that it is business unusual, can we go that extra mile to ensure that these protocols that we have discussed and we are validating this day are just not going to gather dust on our shelves? That these protocols are not for others, they are for ourselves. And therefore, we have to embrace the new thinking. We have to embrace the new way of doing things. We have to go out there and sensitize our members on the need to remain alive. Where we are able to influence policy, let us not tire. Where we are able to be part of the conversation with regard to coming up with proposals to better the lives of our people, I think it is still falling into our own ambit and our mandate as political parties. So I believe that even as we end this conversation today, we are not going to stop discussing the issues that we have raised. Because this is our document, let's own it. Even as we meet at the board next week or thereabout, let us ensure that we give it our best shot. And with those very many words, allow me also to wish you the best of the Christmases you have had, because 2020 has been the best year that we have lived as Kenyans. Asanteni sana na mbarikiwe. So bye from us as NAK Kenya, bye from us as CMD. Mungu atazidi kuunganisha pamoja. Henry, don't forget that you have an assignment.
Yes, yes.
Bye.
Thank
you.
you. Bye.
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 Thank you, Maureen. Thank you, Henry. Thank you, Tabu. Thank you, Lioness. Thank you, John.
Thank you.
Thank you, everyone.